Hello, this is Dr. Dimitrios Kostopoulos, and this is another episode of the podcast Precision in Clinical Practice, Boosting Profits and Patient Outcomes with Diagnostics. And today we have put together for you a very interesting podcast that promises to provide you with gems, ideas, and tips that can take your clinical practice to the next level. I hope you enjoy it. Let's listen to it. Hello, everyone, and thank you so much for joining me today in this presentation about hands-on diagnostics. I am Dimitrios Kostopoulos, and I would like to take the opportunity to discuss with you the basics of HADS, the basics of hands-on diagnostics, and along with that, how to increase your reimbursements and increase your revenue using your existing patients. So this is what we're going to be talking about, which is also very relevant on this period of time where people are rebuilding their practices post-COVID-19. A few words about me. I have over 33 years of clinical experience. I have a master's and PhD in physical therapy and a doctorate of science in clinical electrophysiology and a DPT. I also have an MD degree from UHSA School of Medicine. I've been board certified in clinical electrophysiology testing, and I have at this point over 27 years experience in electrophysiology testing. I'm a clinical affiliate assistant professor at FAU School of Medicine, and I have served in the SAGE, in the Specialization Academy of Content Experts for the electrophysiology board exam. Finally, I'm the co-founder of the Hands-On Companies, a consortium of companies that span from the area of physical therapy, education, diagnostic testing, and a national franchise in the area of diagnostic testing. I'm an elected member of the executive committee of the Academy of Clinical Electrophysiology and Wound Management of the American Physical Therapy Association. So welcome to this presentation. Thank you for taking the time to watch this. And yes, we will be talking how to take today's reality and do something about it to create tomorrow's hope for a brighter future. And I'm going to be very specific because I know that all of us want to hear numbers. All of us like to function with data. And this is what I will be presenting to you. I will be presenting you with data. So the reality is that those practices that they decided to do nothing during or after the COVID-19 situation, they had a significant decline of their revenues. Some of the practices went from revenues of X dollars, let's say 100,000 per month, per week, per day. I don't care of the time period. I'm just using this number. And in some cases, those revenues were very much diminished. So based on this situation, there are two paths to recovery. A slow path to recovery, which can get you almost to where you were before, and a fast track to recovery, a track to recovery that can lead you to even outpacing and increasing your revenues and the position where you used to be. So one of the important things I would like to mention here is that unfortunately many practices, as they were going through the COVID-19 situation, they did not have the financial means to even recover, to even open their doors. Many practices, there's an estimation of approximately 13% of physical therapy private practices have been unable to open their doors, or they had to close their doors after they reopened for a brief period of time. So this is a very difficult situation. And what I will be talking to you about is not how to go back to 100% pre-COVID. That's not my intention. My intention is to discuss with you the specific strategies where you are going to realize a significant increase in your revenues, a growth in your practice above and beyond to where you were in the pre-COVID-19 era, utilizing and taking advantage of the specific opportunities. As a matter of fact, in our specific practice, our estimation is that implementing the HUD strategies, the specific strategies I'm going to be talking about, we will be at 180% growth within the next 8 to 12 months. So that is the type of growth I'm talking about, that it is totally possible, even utilizing your existing client base without having to spend significant dollars to acquire a lot of new patients. And here are numbers. Here are specifics. We like data, so here are the data. These are practices, some of the practices, a small number of the practices that are being associated with us, with Hands-On Diagnostics. And this is the average revenue they were making before HUDs, from 80 to even a specific outlier here of $180 a visit. But look how the revenue increases drastically for all of these practices, anywhere between 24, 25%, all the way up to 47% per visit when they get involved with HUDs for the patients who are qualifying for the services that you can provide as a HUDs partner. And I'm going to explain all that in a moment. But this is what you're looking for. From your existing clients, from your existing patients, you can start making an additional 110,000 or 360,000 or $500,000 or 800,000 and so on and so forth from your existing clientele. Okay? No additional expense to bring new patients in. This is what you can gain from your existing clients. All right. So what we are talking about is that HUDs, Hands-On Diagnostics, is creating an expansive future that not only safeguards but advances the physical therapy profession. So let's think about this for a moment. The viability of any profession, including the physical therapy profession, is determined by its actual value, but also the perceived value of that profession by the society. Wouldn't you agree with that? So the more valuable a profession is, and also is being perceived by the society, the more viable that profession will be, because the society would want and need the services of that profession, and they will pay for the services of that profession. So let's look for a moment the current model of physical therapy. You do an initial evaluation, you create a treatment plan based on that initial evaluation, a treatment intervention. You do a reevaluation, you adjust your treatment plan, then you continue with PT, and at some point you end the care. So the results of your treatment are based on the ability of this model to provide the best outcomes for your patient, right? So remember for a moment, this viability is determined by the actual and perceived value. So to have actual and perceived value, you have to deliver results. Your results depend, your outcomes depend on the type of model, the type of methods, techniques, treatments, the whole idea, the whole concept that you will implement in your physical therapy continuum of care. All right. So, but let's look at this right now. When your treatment plans are based on just the physical examination, the physical therapy initial evaluation that you are performing, let's look for a moment. What are these outcomes? Where are they based on? Let's look, for example, that you are evaluating a patient for a potential carpal tunnel syndrome. What are the special tests that you do? How do you derive to the idea, to the diagnosis that the patient does have a carpal tunnel syndrome? You do a Fallen's test and a Tinel's test, right? But look at the degrees of sensitivity of the Tinel sign, only 23%, Fallen sign, 51%. For a patient with cervical radiculopathy, what is the number one test that you do? Sperling's test or Quadrant's test. They have 30% sensitivity. What does this mean? What does sensitivity mean? It means that if you have a room full of patients with carpal tunnel syndrome and you did a Tinel on them, despite the fact that all 100 patients have carpal tunnel syndrome, only 23% of them, only 23 of them will show positive on a Tinel sign. The rest, 77 of the patients are a false negative. They have the condition, they have carpal tunnel, but your test cannot show it. Look at cervical radiculopathy. 70% of the patients, 100 patients in a room, they have cervical radiculopathy. Only 30% of them will be able to be identified by a Sperling test. So if we base this data to this, if we base our treatments to these special tests, what type of outcomes are we going to have? Well, let's think of this for a moment, right? We are going through the whole coronavirus situation. Just imagine for a moment that the coronavirus test only identifies positive 30% of the patients who have coronavirus and 70% is false negatives. Would that be a good test? Would you accept that test that will give you the truth only 30% of the time or 23% of the time or even 50% of the time? I mean, you cannot base the results of your test and a treatment in a chance that is equal or worse than tossing a coin that has 50% chance to get heads or tails. 30% chance on a Sperling test? That is even lower than flipping a coin. There's something wrong with this idea there, you know? So let's see now, what can we do about this? Let's look at what is the diagnostics approach. In the diagnostics approach, we introduce a new paradigm for physical therapy. We are implementing for appropriate patients diagnostic testing at some point after that initial evaluation. This diagnostic testing can be electromyography, nerve conduction studies, somatosensory evoked potentials. It can be musculoskeletal ultrasound or neuroultrasound. Yes, measuring that nerve visually and measuring it rather than doing a 23% accurate Tinels. So new research evidence suggests that this new paradigm can offer better clinical outcomes and improved patient experience and increased patient participation in care, and also a significant increase in overall revenue for the practice. So let's see how this would work. When you incorporate these tests in the practice, you will enjoy a sensitivity far greater than the sensitivity of the special tests. Double and triple the sensitivity. So what happens when you are able to diagnose more accurately, to do a more accurate physical therapy diagnosis to your patients? Would you not apply then a more accurate treatment? Would you not then obtain better outcomes from your treatment? Well, let's look at that because there is a proof for that. We recently published a study at the Journal of Bodywork and Movement Therapies with a population of 462 patients. We identified that the physical therapy patient management in the group that received the diagnostic testing, the electromyography in this case, changed by 61% as a result of the tests we obtained from the EMG. On a similar study using ultrasound, patient management changed by about 62% because of the data that was obtained from the ultrasound. So you can see that the patient management changes by a significant amount when you implement these type of tests. And actually, this study was very much in alignment with another study that was published in Muscle and Nerve for primary care practices and the incorporation of electromyography in these practices. There was a change in management by 60% in those cases. So the numbers are very, very similar. So what type of tests we're talking about? We're talking about electromyography testing and nerve conduction that evaluates the integrity of the muscles and nerves from your fingertips all the way up to your neck. Evoked potentials that evaluates the integrity of the nervous system from the spinal cord all the way to your brain cortex. But also we're talking about musculoskeletal ultrasound to evaluate the joint integrity, and neuroultrasound to evaluate the nerve integrity, and VNG testing for vestibular dysfunction. So let's take a look for a quick moment on what one of the HUD's partners who performs diagnostics in their practice had to say about the revenue growth that they have realized from diagnostics.
He entered into that. It became really apparent that there was no way we could step away from what it did financially for our practice. And you can see some numbers here for Superior PT. Our revenue per visit before HODS and PT only, or revenue per visit with HODS jumped up to 137. And so, we see a 31.7% increase. And over 12 months, it's very, very dramatic in what that can do for a physical therapy practice.
So what you see are things that you can get in your own practice too. But let me tell you a little bit about the story, about how did this whole concept came about. Well, I'm going to talk to you about the letter that changed everything, and that was November of 2002, just before Thanksgiving, a couple of days before Thanksgiving. I'm sitting there with my business partner, Dr. Kostopoulos, and our manager knocks on our door in our office, and she says, "Look what I received." And she shows us a letter, okay? And unfortunately, that letter did not contain any treasures, any secrets of any treasures like you could potentially find from a letter in a bottle or something. To the contrary, it included an ultimatum by an insurance company, that was Blue Cross Blue Shield, that they were decreasing our reimbursement from $140 a visit down to $55 a visit within the next 2 months. Take it or leave it. Our other choice would have been to exit the panel and no longer be a provider. In the subsequent months, we received multiple other similar letters here in New York State from other insurance companies. We received from Aetna, decreasing the rates from 112 down to 60, from United Healthcare Oxford, from $88 down to $55, if I remember correctly. So we're talking about very, very significant reductions in reimbursement. So that was the time, that was the point where we had to make some decisions, and we had to really decide where, okay, we're accepting everything and we're not doing anything about it, or really working hard, identifying the right solutions and doing something about it. And because we are the type of people who want to cause things in our environment, we do not want to become victims of our environment. We don't like the environment to dictate things to us, but we want to shape and create our environment. We decided to do something about it. So the observation that we made at that time was that one specific aspect of our business that had to do with the performance of diagnostic testing, which we were doing for a very long time, since the mid-1990s. We started doing EMGs since 1996. That part of our practice had not been affected. And I'll explain to you why it was not affected and the solutions that we identified about that. So let's look at that. What is the problem with physical therapy? Physical therapy is helping so many people out there. It is the profession that restores function of movement, freedom with movement. Why physical therapy has such low profit margins? What's wrong with this picture? Well, the issue comes down to reimbursement. There are several factors that are limiting the per visit reimbursement. The number of procedures you are performing per unit of time, the number of different CPT codes, the number of units per unit of time, guidelines and limitations that exist, such as the 15-minute rule per CPT code or the 8-minute rule, or what is the value of each CPT code and the various insurance restrictions, such as flat rate, contractual limitations. No matter how long the patient stays in your practice, I'll pay you $60. So all of these different limiting factors. So in physical therapy, we have a limited universe of CPT codes. I don't care if you do Maitland, you are going to bill 97140 manual therapy. Or if you do Mackenzie, or if you do trigger points, or if you do this or that, or whatever type of manual therapy technique you do, you're going to bill 97140. If you do proprioceptive training, you're going to bill 97112. If you go right now and you buy the most expensive machine, you spend $50,000, $100,000, and you buy the most expensive machine to do therapeutic exercise, or neuromuscular reeducation. The same reimbursement you are going to get using that most expensive machine, the same reimbursement you are going to get using the least expensive machine, or sometimes no machine at all will get you the same exact reimbursement in this limited universe of CPT codes for physical therapy. You get this? So if you have to use only these specific codes, your only hope is to try begging the insurance companies to increase their reimbursement on those very specific codes, or to try to come up with a different idea where you are bringing maybe some cost-based business in your practice. And I'm going to talk about that. So here are facts. Physical therapists provide the most physical therapy services and receive the least reimbursement. There are studies that show that reimbursements are projected to decrease more and more until the year after 2022. Labor costs for physical therapy are in an increase. They are increasing. It means what? You pay higher salaries. Where are you going to get that money from? Is your reimbursement getting better? No, it's not. You're going to cut down your profit to pay the higher salaries. And of course, while you work 60 hours or more a week, you are getting profit margins of 10% or less. So this is what we're dealing with.
According to data from PT Business Alliance, physical therapy reimbursements are projected to further decrease until the year 2022. Because of that, more and more physical therapy private practice owners settle for profit margins of 10% or less. And they work over 60 hours a week while bringing home less and less money. With physical therapy reimbursements virtually at an all-time low, a solution is needed more than ever. Luckily, Hands-On Diagnostics has created that solution. Incorporating diagnostic testing into your physical therapy practice, you'll improve your patient outcomes and increase your reimbursements by billing new CPT codes. To learn how to get the profits you deserve, schedule a private meeting today.
So, why have diagnostic testing as a solution in your practice? Well, there is a tremendous clinical benefit to patient. Your physician will be able to manage the patient better. You are going to be able to manage the patient better. You are going to have higher reimbursements compared to a single PT visit. Okay, so there are tremendous benefits. Increased accuracy of your evaluation, better patient outcomes, happier, healthier patients who participate in their care, greater clinical autonomy. You are going to be able to get, working with HADS, the only fellowship credential in the world in musculoskeletal ultrasound, as well as board certification in clinical electromyography. You'll differentiate your clinic from the competition, and you're going to be able to bill under diagnostic codes and not under physical therapy codes. Yes, you heard me right. That limited universe of physical therapy codes is no longer valid if you are doing diagnostics. You can bill totally different codes that are paid to the physical therapist by the insurance company, but they are not within this limited spectrum of physical therapy codes. And you are going to be able to create new income sources, adding more than 30% to your total revenue. Many of the HADS partners, they are raving about the amazing results they have been having and the feedback they get from physicians as well as from patients based on the diagnostic testing that they are capably performing in their practices with the whole training that we have provided them with. So once again, we said that the current data indicates that reimbursements will be decreasing. And at the same time, your profit margins will be decreasing. And that is without mentioning that we don't know what's going to happen at this point with the 8% reduction starting in 2021, as well as the 15% reduction from Medicare for PTA services. So we don't know where all this is going to lead, but it doesn't look really bright. So a different solution is needed right now to boost the reimbursements. Okay, so are you going to go for some of these type of solutions, cash-based services, or having selling laser services in your practice, doing gym services, offering nutritional products, white labeling products, vitamins, nutritional products, wellness products in wellness programs in your practice? These are all solutions, and they are valid solutions. But at the same time, these are small magnitude solutions. How much money are you going to make by selling vitamins to your patients? How much can you possibly make by doing gym services or offering nutritional products to your patients? Even laser in some cases. And the other thing is that in order to sell these, you or your staff have to be a good salesperson because you charge cash the patient. The solution I'm talking about here, the solution of diagnostics that offers these revenues to these individuals here, they are reimbursed directly by your insurance carriers, including Medicare and Medicaid. Okay, this is what I'm talking about. Let's see what Angie had to say about her relationship with HUDs.
Yeah, so as Dimi has pulled up there, our numbers are kind of seen on the bottom of that grid. Approximately 30% increase in our per visit. I can say that, last year you talked about the overall kind of the net profit that practices are looking at. Very pleased to say that last year our profit margin was 29%. So, I mean, that's unheard of compared to what the PPS numbers are showing.
So this is one of the HUD's partners, Angie and Joe McGilvray from Apex Physical Therapy, who are realizing a 30% increase in their revenues. So why this happens? Well, I'll tell you why this happens. The national average for an hour of PT is $97. And this is the average. This is not the median. This is an average. So I know that most of you are making much less than that per visit, but that is the national average. This is from data of last year from the P2P, the peer-to-peer group of the the private practice section of the American Physical Therapy Association. Now, what are the national averages of an hour testing of electromyography with neuro-MSK combination? It's $700. It is $500 national average for EMG nerve conduction studies, and for musculoskeletal ultrasound of 2 units, about $200. So that average is about $700. So this is a 1 to 7 difference on what you can get from a single visit of diagnostics compared to what you're going to get from a patient on physical therapy. If you get here, and I'm going to do the math for you right now. If you did $97 here, and you did 10 visits on that patient, which is also a national average, So you would get $970 from a physical therapy, from 10 physical therapy visits. Now, if you did one visit of EMG and neuro ultrasound on a patient, just one visit, you can make $700. So all of a sudden, the financial value of that patient is no longer 970, is 970 plus 700, which makes the value of the patient then $1,600.70. $1,670. Okay? You see the difference there? That's what I'm talking about. Good. So now I'm giving you here some type of projections on what you are looking at. You can literally if you had 100 new patients per month, let's say 20, 25 patients, new patients a week, and you did only 50% on these patients ultrasound and only on 30% EMG on those patients, you are looking at close to $300,000 annual revenues. And again, this is how this is possible. All right. So we have right now 185 facilities in 26 different states. Our revenue as an organization has been going up and up and up through the years. And if you want right now information on how to join us, on how to join Hands-On Diagnostics, please go to hadsmeeting.com and book a discovery call with us. So in terms of credentialing, our board certification programs on electromyography and MSK ultrasound, they have 90% to 100% success rates. We are very strongly associated with the American Academy of Clinical Electrophysiology and Wound Management. Our members are members of the Academy, and many of our faculty are also holding board positions. We're publishing the Diagnostics for PT quarterly magazine. You can look at our book publication, The Private Practice PT Beyond 2020. And here is our model and how it's done.
The HODS prescription to help patients and advance your practice. To the future of PT, massive numbers of people receive information about their back, shoulder, knee, or other problems via social media campaigns. They get directed to www.findbestpt.com, where they choose a HODS-approved diagnostic physical therapy center. Patients arrive and receive a proper evaluation that may include the use of diagnostics such as EMG and ultrasound imaging testing. The physical therapist creates an accurate treatment plan using both data from clinical examination and diagnostics. This plan addresses the patient's real cause of problem with 62% better accuracy. Patients get better faster and they are able to regain back their function. Then they recommend the services to their friends, family, and their doctors. And this is how we create a huge positive impact to society.
And this is exactly how we do it. And we help people with marketing, PR activities. We have a lot of materials that you get to promote to your patients. And of course, we are sponsoring the only residency in electromyography and only fellowship in musculoskeletal ultrasound. I thank you very much for your attention. It's definitely time for diagnostics in physical therapy. I encourage you to go right now to hadsmeeting.com and book a discovery call with us. And I'm going to leave you with this quick video.
Because you're a physical therapist, you're not afraid to face pain. Where many see obstacles, you see opportunities. Because you're a physical therapist, you're always looking for solutions to your patient's pain, dysfunction, or disability. Looking at the surface of a problem will never be good enough for you. You're poised to tackle your patient's problems using every molecule of your body and every modern tool available to heal. Because you're a physical therapist, you're a scientist and a pioneer. You are willing to step beyond the crowd and lead the way. You dare to dream the future of the profession, a future where advanced diagnostic technologies of ultrasound imaging and electromyography are at your fingertips. Hands-On Diagnostics helps you see your patient's pain. Together, we can create your future of physical therapy now. It's time for diagnostics in physical therapy. Seeing is believing. Join the movement now.
Thank you very much for your attention. And as I said, go to hadsmeeting.com and book a discovery call so that we can talk. Thank you very much. Take care, everyone. All right. That's it for today. I hope you enjoyed today's podcast and that you got some gems, ideas, and tips that you can use in your clinical practice that can create a difference in the way you practice and the way you profit. I hope to see you all next week. Until then, have a wonderful week.